Good morning, everyone, or good day, depending on where you are. I'm very much excited to start the conference with this really powerful session this morning. My name is Max Appenroth. I am the Research and Community Sexual Health Officer for GATE, Global Action for Trans Equality. And as I said, I'm very much excited to welcome you here to this physical but also virtual room. We have, I would say, like a real power panel sitting here from with activists from Uganda, Kenya, and Zambia, and also two representatives from MFAR. And I'm really excited to tell you a little bit more about the project that we as a collaboration between GATE and MFAR did. We brought together some activists, researchers, and policymakers basically on trans inclusion in national HIV policy and planning. And we will have a few short inputs from our speakers today, and then we will enter into a discussion. And I will also would like to invite you as people in the room, but also virtually, like if you have questions later, we will receive them no matter where you are. And yeah, I would like to welcome Elise and Jennifer on stage. Elise Lankiewicz and Jennifer Sherwood from MFAR. Oh yeah, Jennifer, you starting? No, come here, come here. And you will give us like a systematic review of trans inclusion in national strategic plans. And the stage is yours.
Wonderful, thank you, Max. Great, hi all, good morning, good afternoon. Great to see you all here. Just waiting for the slides.
You can just click, sorry, click on the name.
Okay. Perfect. Great, wonderful. So as Max mentioned, I'm Jennifer Sherwood. I am the policy manager at AMFAR, the Foundation for AIDS Research, based in Washington, D.C. I'm here with my colleague Elise, and today we are going to present briefly the work that AMFAR did in collaboration with GATE over the past year to both measure current levels of trans inclusion in some important policy documents, and then to discuss how that data can be used to inform policy conversations and galvanize advocacy efforts. So globally, we know that trans populations are at higher risk of HIV. There are huge data gaps, and I was reminded again at how many gaps there are when I was looking for data for this presentation. But all to say is that everything that we do know absolutely points to higher risk. This is data from a recent systematic review that was released last year. A systematic review being a fancy way of saying a study that compiles the results of other studies. And what they found was that trans feminine individuals are actually 66 times more likely to be living with HIV than adults in their country, other adults in their country. And that was true across regions. You can see they broke it down regionally here. I really liked this systematic review because it broke down studies for trans-masculine and trans-feminine individuals, which is rare. And they also found that among studies that looked at trans-masculine individuals, which were far and few in between and concentrated, you can see, in high-income settings, they also found that there was high risk among those individuals at about 7 times the risk of HIV compared to other adults. So despite this data, which is quite convincing, we're still experiencing low levels and inadequate levels of trans inclusion in HIV responses. And this is often due to social and political barriers, inadequate legal protections, risk of violence, all of these things that really define risk. So against this reality, which is that we have both really high HIV risk coupled with really high barriers and political barriers, the conversation about trans inclusion in national policy documents is complex. what we see is that data does not always mean inclusion. And internationally, we have near universal recognition that trans populations are a key population. They're included in every major global funder and policy institutions documents, which point to both the recognition of high risk and the call for specialized services. However, the extent to which national governments and documents include trans people is an open question, as is the question of whether any of these documents really can galvanize change in the absence of political will. So, what we did at AMFAR was to start to address these questions. We decided, in collaboration with GATE, to look at national HIV strategic plans. These are important policy documents which really give us an insight into what a government is thinking, what they plan to do to address their HIV epidemic. It will classically identify which populations it's going to target, set those targets, and sometimes include budgets. They're used by governments, they can be used by advocates to help keep their governments accountable, and they can also be used by international funders to help dictate funding that aligns with national priorities. So you can see that trans exclusion from these documents would be a big problem. I'll pass to Elise really after this to walk through the results of what we did, but briefly, what we measured was we looked at 60 countries' national strategic plans, called NSPs in this presentation, from 5 different UNAIDS regions. Those are highlighted here in dark blue. And in each country, we looked at the plan and we asked, are trans people included in 5 key sections of this plan? First being the NSP narrative section, that background section, but we went farther to ask, are trans people included in the epidemiological data of this work? Meaning, is there a size estimate? Is there a prevalence estimate? We also asked, is there an indicator or target that relates to trans individuals, a budget or an activity or a budget? And we did this because we wanted to really try to measure meaningful inclusion, not just the one-off mention of a population in the background section, but really the meaningful inclusion throughout the document. So I'll pass to Elise to talk through what we found and what this means.
Great. So overall, we found that about 2/3 of the NSPs that we looked at mentioned trans people anywhere in the document, and less than 10% of the NSPs included trans people in each of the 5 key sections that we reviewed. When we looked within the NSPs at different sections, we found that most inclusion was happening in the narrative section, and the least inclusion was happening in the epidemiological data and budget sections. So these are some more regional results of our review. We have Eastern and Southern Africa on the left and Asia and the Pacific on the right. And on these maps where you see a section listed under the country name, that means that there was trans inclusion in that section of that country's NSP. So obviously right away you can see big regional differences in trans inclusion. And I think something important to look at in a region like Eastern and Southern Africa, where trans inclusion is really just starting in NSPs, is that inclusion is primarily in the narrative sections, which is an excellent start, but really narrative sections very rarely translate to actual programming on the ground. And so we really need to push for inclusion in sections like M&E indicators or targets and budgets, because those are the things that we can actually use to hold government accountable for services provided. Briefly, I wanted to bring up the countries that we'll be hearing a little bit more about today. Actually, when we completed our review in March of 2021, which is the data I showed you on the previous slide, since then both Kenya and Uganda have released new NSPs, and they've actually both increased trans inclusion to a couple of different sections, which is fantastic. And I especially wanted to highlight that in Kenya, they actually included size estimate data for the first time. And when we had completed our review, no country in Eastern and Southern Africa had actually any prevalence or any size estimate data for trans people. So this is an exciting time for the Eastern and Southern Africa region, and it's a great opportunity to really push for changes. Now I wanted to show you all a couple examples of what we actually mean when we say quality trans inclusion in NSPs. So in the sections of NSPs that really provide country context, like epidemiological data and narrative sections, what we really want to see is attention paid to the unique priorities that the trans community has that may differ from other key populations. So really general sentences that combine all key populations into one really provide very useful or very little useful information. And so if we can use country-specific and recent data to point to trans community priorities, that's really great. So that's what was happening here in the Gambia. They may not have had prevalence or size estimate data, but they did use IBBS data to point to current gaps that need to be addressed in HIV programming for the trans community. When we look at indicators and activities, we really want to push to see transgender communities separated out, especially from MSM. The public health community has traditionally grouped MSM and transgender people in epi data and activities, and that's really not the way that it should be. What we also noticed is that where inclusion is happening in activities, it tends to be a single activity and a single associated indicator about X% of the trans population will be reached with this set prevention package. And that's really great. It's a good start. But we really want to see activities and related monitoring and evaluation happening across the continuum of care. So this is a cool example from Malaysia, where they're talking about case management, which is actually more of a retention and care strategy. And they're also using peer-to-peer work, right? So we also want to see that services aren't just being provided to the trans community, but that we're working with the trans community to provide those services, because we know that's what works. And then budgets. This is a really great example from the Dominican Republic that I'll walk through in a second. But I would say right now, essentially, any trans-specific budget line in an NSP is going to be a win. We don't have many of them right now. But what would be even better is if money was going directly to trans-led organizations to implement the work in NSPs. And so in this example here from the Dominican Republic, all the way on the left side of the screen, you can see two trans-specific targets. And then as we move over, we have the associated indicators. The big box in the middle is actually a list of the activities that the NSP plans to implement that they hypothesize is going to lead to achieving those particular targets. And then we have who's going to implement them, and then specific budget lines for each year of the NSP. So when we have something like this, instead of sort of like haphazard mention of trans people here, haphazard single key populations budget line, this logical flow through an NSP really opens the door for more engagement, more collaboration, and more accountability, because we know who should be doing what when. So this is a really strong example. And so what can we do to improve NSPs? The biggest thing that government can do is get trans voices in the room when you're doing national strategic planning, when you're creating other policy documents. And that's going to take some financial support. That's going to take some capacity building to help community understand how they should engage in these processes and also why they should engage in these processes. International funders look for opportunities to provide technical assistance and funding directly to trans-led organizations for capacity building. And when you're funding studies, require that trans communities are included in those studies, whether size estimate, prevalence studies, and also require that MSM and transgender people are disaggregated when you're designing those studies, and also engage trans communities in the planning and implementation of those studies. Their input is going to be what gets you good quality data. It's not going to happen without them. And finally, advocates, think about what quality inclusion looks like for you in your NSP. That's your decision. Come up with specific wording, specific priorities. If you can find community-led data to support those priorities, that's great. But the more information that you bring to government, the more likely you're going to get that in your strategic planning document. And many of you may be in the early stages of your NSPs. They run for 4 to 5 years, but it's never too early to start having the conversations with stakeholders that will ensure you get in the room when those conversations are actually happening. and look for other partners that you can align with to get your voices heard. So look for other KP organizations that may have similar priorities. Look for other trans community organizations that may have similar priorities. And look for international and domestic stakeholders that want the same things as you, and start now aligning yourselves together so that your collective voices can lead to impact on your NSP. And that's our presentation. Thank you all so much. Thank you to GATE for being a wonderful partner on this project, and of course to the Elton John AIDS Foundation for funding all of the work you'll be hearing about today. Thanks.
Hello, good morning. I do not have a presentation with me, but I trust that I'm able to convey my message. My name is Alessandra Ogeta. I'm from Kenya. I work for an organization called Jinsi Yangu. Jinsi Yangu translates directly from Swahili to mean my gender. Now, trans inclusion within national strategic plans has been something we've been advocating for quite some time. I think the first thing we noted was we wanted to understand when it's happening. So in Kenya, every 5 years, there's an NSP that is released. And so we had to really situate ourselves in that manner where we know exactly what we needed to ask for, and we knew exactly what we needed to advocate for and when to advocate for it. And so by the time we were approaching government and other key stakeholders, we were very clear about what our priorities were and what we wanted to do. We noted that other key populations have been mentioned, that is MSM, FSW, and PWIDs, but trans populations were not mentioned. So for that reason, it means that your own government does not recognize your community and your population. And budgeting-wise, planning for access to services is a bit limited. If there's no data, there's no inclusion, there's no targeted mention of the population. So the first thing we did, just to echo what they presented, is a size estimation. That was the first thing we did, just to understand what are the numbers. And we did the first estimation, and we targeted about 3 counties. That is Mombasa, Kisumu, and Nairobi. And the size estimations came. Nairobi had about 1064. Kisumu, the total population was 4305. And that was already a baseline, some sort of way of starting the conversation. And through that, we had key consultations with other trans populations. Now, this is now from government level. Government is coming saying that we want to prioritize your communities. So tell us exactly what you need. What are your needs, right? And so those consultations went on. Then we did start the advocacy process, really. And so through all these systematic processes, we were able to be, like they mentioned, negotiate for what are the essential services and what are they like to use the word essential services and desirable. So we had to specify what government could commit to and what we really wanted. So it was a whole negotiation process. And we came up with the first, we created the transgender guideline, where it spoke about all the interventions that we needed. That is from the structural interventions to the biomedical interventions to the biobehavioral interventions, and we really named them particularly. And we were very clear about what we wanted and where we wanted them to be placed and all that. And through all that, we were able to start the process of mobilizing resources from the Global Fund mechanism, from the USAID mechanism, and I think another important thing is also understanding that when this the country operational plans are happening, are we in the room? Do we know what we are asking for? What is the minimum package and all that? And so I can go on and on about the process, but the initiation, we had to be very strategic and we had to be very targeted. I think that's the key message here, really. And we need to support our trans communities wherever they are, just to allow, because sometimes government cannot know what you need and until you request and you say this is what we need and this is what our community needs and this is our priorities and all that. Most people don't know how to approach that process, and I think the support we need. Other countries, at least, we got a lot of support from GATE and other institutions around how to position ourselves. So, thank you.
Good morning, everyone. Jem Molucha is my name, and I come from Uganda. I'm a trans man, and I head an organization called Femme Alliance Uganda. We tackled the NSP, the National HIV and Strategic Plan project, and as you can see, these are some of the participants who participated in the National HIV Strategic Plan in Uganda. And all of them came from different regions of Uganda, and all of them are trans, and they come from trans-led organizations. This is who we are as Femme Alliance. It's an LGBTQ organization in Uganda, and our mission is to promote human rights and restore the dignity of LGBTQ through research and advocacy, supporting personal development and combating violence. And we do this through strategic partnerships that we really need. This is the overview of the NSP process. In 2020, GATE and AMFA successfully submitted a project request to the Elton John AIDS Foundation. The project was aimed at increasing the engagement of trans people in the development of national HIV strategic plans. Through this project, GATE engaged with a consultancy group who prepared 2 guides to increase the engagement of trans people in NSP. One for communities and the others was for the government. Our organization as Femme Alliance was trained using the guidelines, and after we were guided to develop a work plan on implementation of the guidelines, which was supported with a budget. Uganda's NSP, just like other African countries, excludes trans persons in development and key sections of the strategic plan. Our priorities for Uganda on this project included training more trans activists and grassroots advocates on the NSP, develop a written analysis on how the current NSP addresses or disregards the issues of trans persons, conducting a scorecard to measure the inclusion of trans persons in the NSP process, and train key stakeholders about trans-specific needs and inform them about the proposed appropriate languages in the next NSP. During the training, these are the participants who were participating in the training, and this was part of the group work that we had. We had some learning experiences during the National HIV Strategic Plan that we were conducting in Uganda, and these are some of the pros. We were consulted throughout the development, which they never contact us during different processes, but this time around we were consulted throughout the development, validation and training of the guide, which we found to be quite empowering. The project created a resource document that the trans community in Uganda continues to utilize as a tool. We were assisted in developing prioritized actions with finance in order to participate actively in the NSP-related activities. It should be noted that Uganda is approaching the next NSP review. phase, this initiative provided an opportunity to influence priorities and re-engage with NSP priorities using the insights gained from this project. Online trainings were quite beneficial. We may continue to refer to them or acquire a refresher at any moment. A lot of trans persons in Uganda were not aware about the existing of the NSP. Thus, this initiative was a learning and empowering experience because most of the trans communities or the trans people that we were approaching at the time, they would ask you what an NSP is, what it means, meaning that they didn't know anything about the NSP, but with the coming up of this project, at least now they know what the NSP means. The trans community is now more than ever very interested in participating in the upcoming NSP reviews because initially most of the trans people in Uganda didn't know about it, but once they got to learn about the NSP, now they are very much interested in participating in the review. This initiative was an eye-opener to the trans community in Uganda, influencing a lot of related advocacy. We managed to document the process, especially highlighting best practices and lessons learned to facilitate continuous evidence-based advocacy. We also managed to create partnerships, especially with key stakeholders, because we didn't have this good partnership and relationship with some key stakeholders, but through the implementations, we managed to get the partnerships that we really needed in Uganda with different key stakeholders. These are the cons. Due to the limited duration of the project's implementation, several activities had to be spaced out. The funding directed to this project was inadequate to facilitate an effective launching of lobbying and advocacy efforts. Criminalization of transgender individuals in Uganda positively affected full participation because we all know the laws and policies in Uganda don't favor trans people. So it's kind of hard to always approach different trans people to get involved in such national advocacy things. The COVID-19 negatively impacted the implementation of the project because most of the different stakeholders that we really needed to approach and target, we didn't manage to get them physically because of this challenge. These are the lessons that we learned throughout that process. Active participation of trans people will require continuous interactions, beginning with the smallest unit, brackets health facilities, and progressing to the national level. It will demand persistency and continuous lobby as opposed to one-time initiatives. Data is one of the greatest impediments to trans engagement. Therefore, it is crucial that trans people are able to collect their own data and advocate for the government to prioritize this. Because most cases, we know very well that the data that has been collected on our behalf, not us doing it. So we really need to make sure that trans people are always involved in all these activities. The resource guide was really useful in improving the community with concrete guidance on engagement stages and actions that can be taken. The participation of government officials and the development of a guide, especially for the trans community, helped pave the path for an open dialogue. Trans engagements increased with the level of investment in trans-led lobbying and advocacy activities, such as this project, when trans activists are well equipped to execute their own community-led advocacy actions. Thank you so much. I still had recommendations, sorry. Yeah, more time and enough resources are needed to facilitate the effectiveness of this project. More meaningful involvement of the trans community in Uganda in the designing, planning, and implementation of interventions that directly respond to our needs. Continuous promotion of collective advocacy among the trans community in Uganda. There is also need for more research and documentation to facilitate continuous evidence-based related advocacy policy, because the research that we have in Uganda about the trans community is really low. So we really need to improve on the researches. There is need for to bring on board more strategic partners to help in pushing for this agenda at different levels. Thank you.
Thank you, Jerry.
Good morning, everyone. So my name is Sean Chintu from Transbantu Association Zambia. I'm the director, and the organization was formed in 2012. And basically, our objective for formation of the organization was to ensure that we're improving transgender, gender non-conforming persons and intersex persons' access to socio-economic, political, legal status, and also ensuring that they are able to access some of these services. Our organization was developed basically to see beyond just creating a safe space, but to ensuring that the communities self-actualize themselves or see their full potential. I don't have a presentation, but my previous colleague, the previous speaker, has shared about the same process that we went through with working with AMFA and the NSP project. However, for us, it's a little bit different than Kenya and Uganda. For Zambia, transgender is part of the National AIDS Strategic Framework, and we've been part of the design of the NSP, the National AIDS Strategic Framework, from 2015. So, meaning most of our engagements in the country were called to the table. However, besides being the transgender community being included in the NSP, we did realize that the community was not aware of this and what that meant. So in the past year, 2 years, while we've been working with AMFA on this project, what we have done is just try to understand what kind of services that we have available. And that was 2020, 2021. And most of the services that we have available are mostly HIV services, prevention, and being linked to access and care. And at the same time, my organization has actually been part of implementing activities in 2 different areas, one in Kafiwe and one in Western Province. In Kafiwe, we worked with other organizations to ensure that the trans community was linked to HIV services and HIV care. However, there were different challenges that we noticed while linking the community to services, and some of these we took note, and I'll be sharing them. And then in 2020, 2021, through this year, we are working in the Western Province in the country in 4 districts, where we are implementing HIV prevention, treatment, and care services to transgender, MSM, female sex workers, and other key populations. So again, while we are implementing with our partners, we have also noticed again the different gaps and the different understandings of the transgender community. So zooming back on the transgender inclusion of the national of the inclusion in the NASIF, the National AIDS Strategic Framework, what we have done in the past year is that we've had different dialogues with community members in about 5 different provinces, plus the ones that we're implementing services in. And basically, what we're doing is trying to understand from them, having a conversation if they are aware about the existence in the National AIDS Strategic Framework, if they are able to access services freely, and what that actually means. So we have come to understand that in the five organizations that, in the five provinces that we've had community consultations, most community members do not, first of all, understand what the National AIDS Strategic Framework is. They do not understand that they can easily walk into a health facility and get services. So we've had to share this and also ensure that they add their voice to the consultations that we're having with them. And then also what has been noticed during this community consultation is that besides their understanding and then being able to access services, some of them have not been aware that they can be given treatment to cases like anal warts, for example. So with our engagements with them, we've been able to say, look, these are services that you can get, and you should be able to get this, and you should be constant in getting these services. Besides that, some of the gaps that we've noticed when interacting with the community is that as much as the NSP recognizes transgender persons, transgender men, however, and intersex people are not really a priority, and the thought is that they're at low risk at low risk of at low risk of getting infected. But then it has been identified that there's need for us to increase the spectrum, because as much as it's transgender, it's mostly focused on MSM. So the transgender men and intersex folk also feel that it's very important that they're part of the process. So that's the voice that we're getting from the community. Also, we with interaction with the community, we noticed that the NSP does not speak of standard operating procedures of, for example, transgender and intersex individuals, and this obviously has to be unpacked further, because the transgender community also is looking further than just getting HIV services, but more comprehensive health care. So with also conversation with the community, there's been a realization that there is need for us to share more information with the community, one, but also have more conversations with healthcare providers, because obviously the listing is one thing, the conversations from the community, the community being aware is another. So we've realized that those are some of the gaps that ourselves as civil society obviously can bridge, but also we can ensure that our community is aware. And then we also noticed that from the conversations that we've had with them, some of the community members were not aware that they would have, specific STI screening, and these are some of the services which are already being provided. So as much as the community is stated in the National AIDS Strategic Framework, the communities themselves are not aware of what services are available. Therefore, it is something that we will continue to do and we continue to do. So following that kind of interaction with the community, we've moved ahead to have different focus group discussions and still link community members to different health facilities in the different areas. And then to best interact with the NSPs, because our current NSP is 2017 to 2021, which is almost, the period is over. But however, there is conversation of doing a revised NASIF, which will extend from 2022 to 2026. So in preparation of that development, we're trying to gather as much as we can from communities so that we can ensure that we bring their issues to the table. And some of the issues that already have been identified are that documents are not easily accessible for community members, for them to be able to know what it is that they are able to access or not. So we'll be able to then provide that gap for the Ministry of Health or National AIDS Council, for the community to be able to know that these documents exist. They can also add their voice on what needs to be improved, and some of the issues that we are documenting can then be highlighted in the documents. And then we've also ensured that we engage the community through dialogues and meetings on different levels that need input into the national strategic documents. So, for example, in the past 3-4 months, there's been development of a national KP advocacy, safety and security strategy. And the National AIDS Council has actually been inclusive of our organization, Transbantu, and other KP organizations to come on the table to ensure that the needs that our community is that we're working for are identified and are added to the documents. Then secondly, first of all, there have been a few studies, for example, panel study of 2013, and another key populations study under the POP Council in 2014-15 as well. We noticed that the data collected isn't substantial data for transgender community, and to be able to identify how many people exist and what kind of services they need. So, and that's because obviously of the different questions that were asked, and the mixing up of the populations, MSM, transgender. So with that, it has been realized that there may be need to revise some of those questions and redo a size estimate. So there's been a conversation about having another size estimate, but obviously making reference to studies that have already been done. And then and then we've been brought to the table as well to just ensure that we look at what has been done, look at the protocol, look at the questions that will be asked, and then also be part of the process. So I would like to say that on our end, as much as there's inclusion of transgender people in the National AIDS Strategic Framework, there's also been a lot of efforts to ensure that there is participation of the transgender community through different organizations and through different collaborations that we have made. And then probably the other thing worth mentioning is that in the past also a few months, there's been conversation, because Transbantu is part of what we call the Zambia Key Populations Network, and we've had conversations with our National AIDS Council to ensure that we are part of of the CCM. So basically, right now the CCM does not have a sitting for the key populations. However, we've been allowed to observe CCM proceedings for now. So currently, we have representation from two people from the Key Populations Consortium, one from people who use drugs, and one from the transgender community, which is for us a good strive, and at least that then shows that beyond just being written in a document, there is implementation interventions and happening, so to ensure that the community is part of the design and development of the different interventions and the different documents that are being done and the different strategies. So it's a good stride. So moving forward, I mean, there are different recommendations which we have. One is for ourselves, the findings that we're doing from our baseline study for the community, to ensure that we share to feed into the NSP, and then secondly, to encourage the National AIDS Council, Ministry of Health, from our organization, from our country, to ensure that we're always brought to the table to be part of design and development. Thank you.
Sorry. Thank you so much. I don't know if the microphone is on. Can you hear me? Yeah, now it works. Now I can hear myself as well. Thank you so much to our speakers for your input. I think you gave a really good overview about what we, as like a really collaborative working group in between different organizations in different regions with different populations and different needs, also have actually brought together. And we gave a great example of how work like this can actually look like, and that we come, like with outcomes, that there is actually something that we can achieve together and that we can present. And I would like to start to remind the and anyone in the room, but also our virtual listeners, that you can submit questions if you have questions to people on the panel, like to the panel in as a group or even to individuals. Please write them to us. We're happy to, like, I receive them here on a little screen, so we can include you in this session. And also, if you were wondering, because there's another person named on the list of speakers today, unfortunately, Erika Castellanos from Gates had a little hiccup with traveling, but she's going to arrive today. But just so you know, that in case you're wondering where she is. And I would actually like to start with Jennifer and Elise, because you mentioned in your presentation that oftentimes trans people are mentioned in national strategic plans, but they rarely go beyond the narrative section. So, you know, it's kind of like, for me, it sounds a bit like, oh yeah, we put trans people there. So if someone looks for trans people, you have like 5, you know, hits that they are somewhere in the report. But like, what would it be for you, or like, what is what needs to be done to go beyond just including trans people in the narrative? Like, what would be your recommendations, or do you have any like ideas how you would address this issue?
Oh, is it? Okay, great. Yeah, no, I think that's exactly right. I think the narrative section is not that actionable, really, you know, and there's nothing for advocates to. It's important. It's important to be there as a minimum step, but it's hard for an advocate to look at a NSP and use that to really hold a government to account with just a mention in the background section. Much more actionable would be a target set for activities for trans communities, or a budget line, so that could be something that communities can follow up with and say, well, it was written here that you committed to these things in writing, and that hasn't happened. So I think importantly, you've got narrative sections which as a minimum show recognition of population, but then the really actionable sections are further down. And so I think as a recommendation, it would be to include populations not only in Word, so that the next researcher that comes along can do a checkbox for that background section, but more fully included in targeting and budgeting well into that plan. So I don't know if you have anything to add, but.
Yeah, and I think, you know, how we get there is by creating space for meaningful engagement in these processes, right? If my colleagues here on the panel had been given space to meaningfully engage in their last NSPs, right? They wouldn't have said, yeah, just throw me in the narrative, right? This team knows what priorities their communities have. They know what activities need to happen. And so if there's room for engagement in those discussions, then that's how we're going to push past the narrative and get inclusion in later sections in the NSPs.
Thank you so much for that. And I mean, also, Alessandra, you mentioned in your presentation that we as a community, we kind of like support, we kind of like depend on the support of institutions, that it's crucial that we can do a lot on our own, because often we are on our own, but we still depend on institutional support. And like thinking about like what could be like also like concrete steps that institutions, regardless if it's research institutions, if it's governmental institutions, like what are concrete steps how, let's say, like a meaningful inclusion of trans people can look like?
That's a difficult question, but I'll try to tackle it. A meaningful inclusion, I mean, automatically for me that means dialogue. Conversations and prioritizing exactly what the community says they need, right? And listening to the communities, and I'm speaking now from the side of asking from government, and this is what we told government. We told government that we needed these services, and we also, meaningful engagement for me also means that who do we walk in the room with? How do we have collective bargaining? And how do we engage with our strategic partners to say, they have done it before, why can't this movement do it before? And how can we actually just walk together? I think it's an intersectionality question, right? It's not a question of doing things in an individualistic a manner. It's a process of saying that these processes are there. That it's not the first time Kenya is doing it. They have been done before. Our job is really to implement whatever has worked, contextually integrate what has worked, and give those stories and say, this has worked here, how do we domesticate? For example, we have things like the transgender implementation tool. How do we domesticate that in Kenya, right? And looking at those processes and saying, okay, this can work in Kenya, this cannot work. And then beyond the NSP, how do we also work with other subcategories of policy documents, right? Have a particular transgender guideline, for example. Have advocacy manuals, for example. Have paralegal manuals that are very specific to the trans community, and how are we training our paralegals to advocate for rights, and how are we working with the police, how all these things. I can go on.
I was just about to say, I mean, like, I think one can hear that that there is a need, like, for definitely, like, for more work and, like, more awareness around the work that we do. And you just mentioned intersectionality, you know. We heard in the beginning, like, it's important to have trans people mentioned as a group by themselves, but at the same time we also need to be aware with how many other groups we intersect. Like, I sit here as a trans MSM, you know. It's like, you know, this is something that, or a lot of trans people are sex workers, a lot of trans people are people who use drugs, and so on and so forth. So this is something we need to be aware of, that there is so many intersections within the group of key populations. And I think this is something where specifically institutions need to start listening and learning from our community and our experiences. And Jay, I have a question for you from the online audience. And at this point, the reminder again, if you have questions, please come forward to the microphones, as well as submit your questions online. So a question for you is how donors and partners can support you to continue the amazing work that you do. I mean, you explained to us how you started the organization, like what were the reasons behind them and the important work that you do, but like specifically directed at donors and partners, what are your needs to continue what you're doing?
Okay, thank you. The donors, right now, as we know, you know very well that there has been limited funding for the trans people in different areas. So there is a big space, a big gap that is there, and this has lacked the trans activities or projects to go on because of those limited fundings that come towards the trans projects. So I think we need to, raise out our voices and stand up as the trans community to make sure that the donors hear our cry, because if we look at the data, the research, it is not there. Especially, I'm really talking basing on what is in my country. We lack the data of the trans community. We know very well that trans people, especially I will talk about trans women, have been mixed up with the gay community or the MSM, and these people are always using these trans women to get their data, and we as the trans people don't have our own because of that mix-up that is going on. It's because we lack even the funding to carry on all that these activities, to find out the data. We need to find out to do the research, more research about the trans community. We don't have all that information, so it's a big challenge. So we need to call on to donors to really come and fund or participate in our projects. Yeah. Thank you so much.
Thank you, Jay. And Sean, I remember that you said that it was kind of like difficult to inform local community about like why is it important that we're actually being mentioned in the national strategic plans. Like, what is it? Like, why do we need this as a trans community? And do you have any ideas, like how you would describe how projects like these, or like trans people being included in national strategic plans, how that actually at the end of the day improves the quality of life of our community? What does it do in order to, for example, access healthcare and the like? Do you have any thoughts on that?
Yes, thank you. So, well, I have a lot of thoughts. First of all, would be one. Sometimes when we create some of these documents, we put them online, thinking, or rather, print them and give them to our officers or give them to stakeholders that we work with all the time. We forget that not everybody is online. One. Two, some of the stakeholders that we're working with are probably just in the capital, and then probably not everybody can read, right? So my thoughts around that then would be that whenever we create documents, we ensure that they see their way down to where they're supposed to be. So that would be, for example, for an NSP, if there's somewhere to leave it open, or a summary of it to be put somewhere in a facility, in a health facility, so that when I go there I can see, that would be helpful. But also maybe do a little sized info packs with drawings, and probably also local languages, because remember, not everybody can read, so the local languages in different areas would then be able to help me understand what is happening or why I need this particular service. And obviously, our countries are not very small, and we're quite a lot, and obviously in different regions or provinces. What would help is that we need to make use of the existing structures that are already there. So, for example, I'll give an example of how maybe the National AIDS Council is formed or made up of. They've got a provincial person, and they have a district person, and the district people are working with communities. I think there needs to be effort, not just from the end of civil society. There needs to be effort from the end of the government to see which civil society is working on the ground to ensure that we link to the communities that we are serving. The transgender and intersex community is a population that doesn't come out to say, I'm transgender, I'm intersex. They keep to themselves, and especially in a place where they do not exist. For example, they're not recognized by the law. You will not be able to have access to the community. So there's a lot of intervention that needs to be done to ensure to reach the community. And then lastly, you said how this would encourage health-seeking services. If we encourage health services that are free of discrimination and just treat me as a person, people would definitely come forth. I think there's a lot of sensitization that needs to happen, not just from civil society, but from the organizations, from the government, and we are available to help, to assist, and that's why we exist, to support where the government can't. Thanks.
Thank you so much. I see that there's people standing here. I would say we can do probably one more question and maybe have an ongoing conversation afterwards if there's additional questions. I would.
Thanks. I'm Jeff O'Malley from UNDP. Thank you, Gate and Amphar, for this great study and presentation. I'm interested in next steps in terms of building on this work and what Gate and Amphar are doing. Obviously, national strategic plans matter a lot. I think probably most of us also know that what's in PEPFAR COPs, what's in Global Fund country proposals matters. And then also, even when it's in a COP or a country proposal, is the money that might be allocated eventually, is it actually going to trans-led organizations and so on? And so are you currently involved in these kind of next steps? Sorry, there's always more work, but this was a great first step. I want to know what you're doing in terms of moving forward that analysis.
Okay. No, you can just answer. We're already at the end of the time, but we're going to answer that question. And as I said, I invite everyone to an ongoing conversation afterwards.
Okay, great. Yeah, a great question. That is certainly on our radar. It is something that we would love to continue and have started thinking about, both in terms of I think tracking the money is a really important thing to do. PEPFAR and Global Fund, we've started looking at documents and trying to work with organizations to get the data out of Global Fund and PEPFAR to look where the money's going, how it's being spent, and if that investment is matching the burden. And so the short answer is yes. Would love to talk more, and I think importantly, that's a good research initiative. But also the identity or the projects that have been identified here on the panel, among others, which is really data collection efforts being led by local communities to combat some of this erasure that's been happening, is also a next step that I think we should really invest in. So.
Thank you so much, Jennifer. Unfortunately, as I said, we're at the end of our time, but if you have another question, I would invite you to come later and talk to us after the session, because we unfortunately have to close. And I would like to thank our panelists, Alessandra, Sean, Jay, Jennifer, and Elise, for being part of this panel. And yes, we can give a round of applause here. And as I said, please keep discussing with us, have the conversation with us. We'll be around the conference all these next days, and I'm sure that there is more that we can exchange in terms of ideas and how to go forward especially. So thank you very much for coming today.